Hello students, today we will discuss about the muscles of the front of thigh. Now when you will see the muscles of the front of thigh, what are the important things which you should know? That the muscles of the front of thigh includes the muscle which are present in the anterior compartment. Now when you will see the section of the thigh, you can see that we divide this thigh circumference in the three compartments with the help of the intermuscular septals. Now this compartment is the largest compartment which is known as front of the thigh. Clear? Now there is one more compartment which is present on the posterior side of the thigh, that is the back of the thigh, in which you will have the hamstring group of muscles. Now there is one more medial compartment. Now this medial compartment is having the muscles which are known as adductor muscles. That's why this is known as adductor group of muscles and this is adductor compartment of thigh. Clear? So today we are discussing the muscles which are present in the front compartment of thigh. So when you will see the muscles, these are the three main components of the front of thigh. What are they? Sartorius, Quadriceps femoris and Articularis genus. The main muscle of the front is Quadriceps femoris. Apart from these three muscles, you are able to appreciate the psoas major and iliacus muscle. When you will discuss the femoral triangle, you will find these two muscles in the floor of femoral triangle. But these muscles are basically comes from the iliac region and posterior abdominal wall. But we will discuss the origin insertion in this today's lecture only. Now there are two more muscles which are also present or the visible in dissection in the front of thigh, that is adductor longus and pectineus. Now these two muscles again visible in the femoral triangle, but these two muscles are mainly considered as a muscle of adductor or medial compartment of thigh, and we will not discuss these two muscles in this lecture. Now the muscles in the anterior compartment, they act on hip and knee joint. Now there is one important concept to understand, that any muscle, if it is crossing the joint, it has to act on that joint. Clear? Now here you will find that some of the muscles are crossing the two joints, that's why they are acting on the two joints, hip and knee. Or if the muscle is crossing only a single joint, then it is acting on a single joint only. Clear? So here you have the psoas major and the iliacus. These muscle crosses the single joint and that is hip joint. So they act on the hip joint only. While there are two muscles in the front of thigh which crosses the two joint. So this is the question for your exam. Name the muscles of the front of thigh which act on hip and knee joint both. Answer is Sartorius and Rectus femoris, which is one of the component of Quadriceps femoris. Now the Vastus muscles, which are the remaining components of the quadriceps, they cross only the knee joint, so they act only on the knee joint. So when you will see the arrangement of the muscles in the front of thigh, you will find that you have a long strap muscle, that is the Sartorius, and apart from that the main anterior compartment is formed by the Quadriceps femoris. Apart from that, in this upper part you are having the muscles which are known as iliacus and psoas major. So these two muscles are crossing the hip joint, so they are acting on the hip joint. But this muscle is not only crossing the hip joint, but here it is also crossing the knee joint. So this muscle is acting on two joints. Clear? Now let's discuss each and every muscle one by one. So first is the Sartorius. The most important question about the Sartorius is that this is the longest strap muscle in the body. So you have this one-liner question, name the longest strap muscle of the body. Answer is Sartorius. Now apart from that, when you will do the dissection, you will realize that this muscle is superficially placed. So when you will remove the skin and deep fascia, immediately you will find a long strap muscle and it is a Sartorius. Now what is the origin of this muscle? Now whenever we are reading any muscle, we always talk about the four important parts: origin, insertion, nerve supply and action of that muscle. So, first, what is the origin? It arises from the tendinous fiber from anterior superior iliac spine and the upper half of the notch below the ASIS. Now, you know that this anterior projection of hip bone is known as anterior superior iliac spine, and adjacent to this notch, this spine, there is a small notch is present between the anterior superior and anterior inferior iliac spine. So, when you will see the lateral view of the hip bone, you will find this type of the anterior border. So, this will become anterior superior, this is anterior inferior iliac spine, and this is the notch. So, this muscle is arising from the ASIS plus the adjacent part of the notch, clear. Now, it descends obliquely. So, when you will see the origin is on the lateral side. Now, this is our midline of the body, and when you will see the limb, you will realize that if you will draw the vertical axis of the limb, it is arising from the lateral part of the limb. Now, it crosses the limb from lateral to medial side. So, it appears in the thigh from anterior superior iliac spine to the medial surface of the proximal shaft of tibia. Now, here in the lower part, you will find that it crosses the knee joint from the medial side and it comes on the medial aspect and ultimately on the proximal surface of your medial part of tibia, clear. Now, what is the exact insertion of the Sartorius? Now, this is very commonly asked question in your exam about the insertion pattern of the Sartorius, because you will realize that the Sartorius is inserting in the form of a flat aponeurosis or broad aponeurosis, and this insertion is very important because there are attachment of 3 muscles at single point, and these muscles are gracilis, semitendinosus and sartorius, clear. So, the muscle fiber form a thin and flat tendon, and this is known as aponeurosis. The aponeurosis attached to the proximal part of the medial surface of tibia. Now, this is the important thing to understand, that when you will read the tibia, you will realize that the whole medial surface of the tibia is subcutaneous except its proximal upper part, where you are receiving the insertion of 3 muscles. Now, the first and most superficial muscle is your sartorius. So, when you will draw the medial surface of the tibia, in this upper part you are having a inverted hockey shape insertion of sartorius. Now, behind the sartorius you are having the insertion of gracilis, and the posterior most you have the insertion of semitendinosus. So, there are 3 muscles on this one point on the upper part of the tibia: gracilis, semitendinosus and sartorius. But the sequence is important. The most superficial insertion is the sartorius. The upper end of the aponeurosis arch backward. You can see that it arches backward over the top of the gracilis and semitendinosus. So, together 3 muscles or the 3 tendon are known as pes anserinus or goose foot. So, this is again the one liner question, what is pes anserinus or goose foot? It is a pattern of the insertion of 3 muscles, clear. Now, what is the action of sartorius? Now, when you will talk about the action, it is a abductor and lateral rotator of thigh. Now, why it is abductor and lateral rotator? So, for that you have to see the direction of the fibers. Now, see, the fibers are crossing the hip joint from lateral to medial. Now, once it is lateral to medial, it has to pull the femur on outer side, because this will become the origin. So, when it will pull, the pull will go in the upward and outward direction. So, once the pull will go in upward and outward direction, the femur will rotate outside. That is why it is a lateral rotator of your thigh, clear. Along with that, it is also abductor. Why abductor? Because again the pull is in this direction, so it will take the femur outside. If the muscle is coming from inner to out, then the action become reverse. So, you have to keep this concept in mind, that this muscle is coming from lateral to medial side, and because it is coming from lateral to medial side obliquely, the force is going upward and outside, and because it is upward and outside, it will keep this femur abducted and laterally rotated. The another important thing is that it is a flexor of your knee joint. Now, why it is causing flexor? Because now here you can see that this is the tendon of the Sartorius, which is crossing the joint not from the front. Now, if this tendon comes on the front, then it will become extensor of your tibia or knee joint, but it is going on the medial side and then it is attaching here. So, when the pull will take place, it will take the tibia posteriorly and it is helpful in the flexion of knee joint. So, these are the three important functions. It is a abductor and lateral rotator of thigh and flexor of knee. Now, the Sartorius draw the lower limb into the sitting Patellar's posture. That is why this muscle is also known as Patellar's muscle, which is again the question of your exam. So, what is the Patellar's muscle? Patellar's muscle means when a tailor is doing stitching on sitting posture, not on the ground, but on the chair. Now, when he is sitting on the chair, the limbs are semi-flex, plus the both limbs are laterally rotated and abducted, and then he is moving his foot and he is doing the stitching. So, that position of the thigh, that is laterally rotated and abducted thigh, is possible because of the action of Sartorius, and that is why the word comes Patellar's muscle. Clear? Now, what is the nerve supply? You know that anterior compartment is supplied by the femoral nerve, and we are reading this in the anterior compartment. So, but obviously the nerve supply is femoral nerve, and which root value? L2, 3, 4. Now, what are the important relations of Sartorius? When you are doing the dissection of the front of thigh, you find that Sartorius is a very important landmark in identification of two important things. One is your femoral triangle and another is adductor canal. So, in upper 1/3 of the thigh, the medial margin of the Sartorius form the lateral margin of femoral triangle. Now, this is the important concept to understand. Now, my dear students, here you can see that this is the femoral triangle. Clear? Now, there are two ways to draw this femoral triangle. This is the one way. The another way is that I can draw this triangle in another pattern, and this is here. I can draw the line from here also. Are you getting my point? So, what is the difference? The difference is that the femoral triangle is formed by this margin of Sartorius, not by this outer margin. Clear? So, that is why it is written that the medial margin, that means the inner margin of Sartorius, forming the lateral border of femoral triangle. We are not considering this lateral border of Sartorius as a boundary of femoral triangle. Clear? The second thing is that what are the another important relation? In the middle 1/3 of the thigh, Sartorius form anterior wall of adductor canal. That is why it is known as subsartorial canal. So, when you will do the dissection in this portion, in the middle portion here, you will find a canal, and that canal is not visible here because it is covered by the Sartorius muscle and it is known as subsartorial canal. Sometimes this muscle is pierced by a nerve, and that nerve is a cutaneous branch of femoral nerve, and it is known as intermediate cutaneous nerve of thigh. So, this is again the question of your exam. Name the muscles pierced by the cutaneous nerves. Now, what is pars anserinus? Now, pars anserinus comprises three tendons: Sartorius, gracilis and semitendinosus muscle. Now, these three muscles comes from three different compartments. Sartorius comes from the front of thigh, gracilis comes from the adductor or medial compartment of thigh, and semitendinosus comes from the back of thigh. And all the three muscles which are coming from the three different compartments are approaching to a single point, and that is your upper part of the medial aspect of tibia. and these three muscles are supplied by three different nerves. One is femoral, one is obturator, and another is tibial nerve. These are the three nerves of three different compartments. So, the muscles are sometimes also referred as a gyropes. Now, what is gyropes? Gyropes means the ropes which are controlling a conical thing, a larger triangular thing on a small base. So, suppose you are having this type of some structure and you are keeping this balance on a single point. Now, this whole structure is known as gyropes, where you are balancing the structure on this small point. Now, here the same thing is happening, that these three different muscles which are acting like these ropes are holding or balancing this pelvis on the tibia. That is why it is considered as a gyropes. So, the main function of these three different compartment muscles attaching at one point is that they are providing stability and weight distribution of the pelvis on the femur and tibia by having this gyrope arrangement. So, this is again a short note for your exam on the gyropes. So, you have to keep this thing in mind, that gyrope is formed by the three different compartment muscles, gracilis, sartorius and semitendinosus, which are inserting at single point, and they are helping in the weight distribution and balancing of the pelvis. Now, what is quadriceps femoris muscle? Now, we will see that quadriceps femoris is the very bulky muscle of the front of thigh, and it is made up of 4 parts, as the quadri means 4. So, what are the 4 components of this muscle? One is the 3 vasti. Now, 3 vasti are vastus medialis, intermedialis and lateralis, and the 4th component is known as rectus femoris. So, these are the 4 components of quadriceps. The quadriceps femoris is a chief extensor of knee joint. So, it crosses only the one joint, that is vasti group, and vasti group is mainly responsible for the extensor of the knee joint, while its rectus femoris also crosses the hip joint. The rectus femoris is most superficially placed component of this quadriceps, and it lies superficial to the vastus muscle in front of the thigh. So, when you will do the dissection, you are first able to see this oblique muscle, that is the sartorius. When you will cut or remove the sartorius, you will find one more superficial muscle, and this superficial muscle is your rectus femoris, which is coming from above, and this rectus femoris will go down, it crosses the knee joint and ultimately attached to the tibia. Now, what is about the rectus femoris? So, again we will see the origin insertion of this muscle first. So, when you will see the rectus femoris, it arises with the help of 2 heads. Now, there are 2 tendinous heads of the rectus femoris. One head is known as straight head, another is known as reflected head. Now, this straight head comes from the anterior inferior iliac spine. So, now the question you are having, that once you are drawing the anterior superior and anterior inferior iliac spine, the 2 spines are having 2 muscles. Anterior superior iliac spine is having muscle is sartorius, and anterior inferior iliac spine is having muscle is straight head of rectus femoris. Clear? So, these are the 2 important questions for your exam. Now, where is the reflected head? Now, the reflected head comes from the groove just above the margin of acetabulum and capsule of hip joint. Now, when you will see the lateral surface of the hip bone, you know that this lateral surface is known as gluteal surface, which has been divided into the 4 parts by the 3 gluteal line. Now, this lowermost part, now here you have the inferior gluteal line, and below the inferior gluteal line, this space is providing attachment or origin to the reflected head of your rectus femoris, and anterior inferior iliac spine is providing origin to the straight head of rectus femoris. Then both the heads are going downward, they will join each other and they are forming a single muscle which is known as rectus femoris. Now, where is the insertion of this muscle? this muscle insert on the base of patella. Now, when you will go downward, you are having a small muscle is known as a small bone which is known as kneecap or the patella. So, now patella is a triangular bone. Now, its apex directed downward and the base is upward. So, this muscle will come and it attached on the base or you can say upper border of your patella. Now, the posterior surface of the muscle is covered by a glistening aponeurosis, and that allow this muscle to glide on the anterior surface of vastus intermedialis. Now, here you can see that this is the rectus femoris, which is the most superficial component of quadriceps femoris. Now, if you will cut this rectus femoris, you will find that below you are having a intermediate muscle, that is vastus intermedialis. Now, this is the profile or the lateral view of the muscle. Now, you will find that there is a gap between the shaft of the femur and the posterior surface of this muscle here. Why the gap is there? Because in between these two structures you are having one more muscle, and that muscle is known as vastus intermedius that lies here. Now, this vastus intermedius is not having any attachment with the posterior surface of rectus femoris. Rectus femoris is enclosed or covered into a aponeurosis, and this aponeurosis allow free gliding movement of this muscle on the anterior surface of vastus intermedialis. Now, what is the origin of vastus lateralis? Now, vastus lateralis and vastus medialis, both muscles are arising from a continuous line. They are having a linear origin, and the origin is a continuous. Now, when you will having first the vastus lateralis origin starts from anterolaterally. What does it mean? When you will keep the femur in anatomical position, it will having the anterior origin and origin from the lateral side of your bone. So, first origin is from intertrochanteric line. Now, where is the intertrochanteric line? This is the intertrochanteric line, but it is arising from the upper lateral part of this line. So, it is arising from this side. It is not coming on the medial part of this intertrochanteric line. So, this is the first origin. Second origin is that it then turns laterally around the greater trochanter. Now, there is a inferior and anterior borders of the greater trochanter. So, the line starts from here, it will go above, it will come from anterior and inferior border of greater trochanter. Then, what will happen? This part will go posteriorly. Now, in the posterior side, you have reached up to this inferior part of greater trochanter. Now, it continues as lateral margin of gluteal tuberosity. So, this brown color area is the gluteal tuberosity. So, the origin comes along the lateral side of gluteal tuberosity here. Then, what will happen? It will continue downward on the lateral lip of linea aspera. It will continue downward on lateral lip of linea aspera, but only in the upper part, not extending till the lateral supracondylar region, only in the upper part, or you can say upper 3/4 of linea aspera. So, what is the origin? Again, if you will see the origin of vastus lateralis, you have to first keep in mind about the bony landmark. It starts from the upper half or lateral half of this intertrochanteric line, then anterior and inferior border of the greater trochanter, then it will come on the lateral lip of the gluteal tuberosity, then it will come on the upper part of lateral lip of linea aspera. Now, in the same way, if you will see the origin of vastus medialis, the vastus medialis arises from anteromedially. Lateralis was anterolaterally, it is anteromedially, and its origin starts again from intertrochanteric line. But we have just divided this line into the two half, lateral half and medial half. So, the lateral half is giving origin to the vastus lateralis. Now, this remaining medial half is giving origin to the highest fiber of vastus medialis. So, the highest fibers of vastus medialis arising from this medial half of intertrochanteric line. Now, you can see that this intertrochanteric line runs downward and come out as a spiral line, and this spiral line comes on the posterior surface and merge with the medial lip of linea aspera. So, first it starts from the intertrochanteric line, that is the medial half, then it continue on the spiral line origin continue with the medial lip of linea aspera and proximal 1/4 part of the medial supracondylar line. So, you can see that the origin of the vastus medialis is longer, and you have realized that the origin of vastus lateralis is not coming on this lateral supracondylar line. Clear? So, when you are reading the origin of vastus lateralis and medialis, you have to first keep this thing in mind that we divide this intertrochanteric line into the two part, lateral half and medial half. The lateral half will give origin to the vastus lateralis, then it continue on the trochanteric lines, and then it continue on the lateral lip of the gluteal tuberosity and lateral lip of linea aspera. But when you are doing reading the origin of vastus medialis, it starts from the downward half or the lower half of your intertrochanteric line that continue as a spiral line. So, this is the spiral line, and then it will continue with the lip, medial lip of the linea aspera, but the origin also extend into the upper 1/4 of medial supracondylar line, which is not seen in case of vastus lateralis. Now, what is origin of vastus intermedialis? Now, vastus intermedialis is not having a linear origin, rather than it arises from the shaft of the femur. Now, when you will see the section of the shaft, you will realize that this is having the linea aspera, which is the sharpest posterior border. Now, this is the lateral border and this is the medial border of the femur. So, you are having the anterior surface, medial surface and lateral surface of the shaft. Now, here you will realize that this vastus intermedialis having no attachment on the medial surface. Whatever the origin comes from the anterior surface and the lateral surface of your shaft of the femur. So, it arises from the anterior and lateral surfaces of the upper 2/3 of the shaft of the femur. So, here you can see that this is the anterior surface of the shaft of femur, this is the lateral surface, this is the greater trochanter you can see. So, it is arising from the upper 2/3 of the shaft of the femur anteriorly, and this origin continue on the lateral side and it will come here. Clear? So, you have to keep this thing in mind that vastus intermedialis is having origin from the anterior and lateral surface of the shaft of femur. The anterior surface of the muscle is covered by the aponeurosis, which I already told you. That is why it is having a slippery or the gliding is possible between the rectus femoris and vastus intermedialis. Now, in this video, if you will see what you are able to understand that how you have to identify that origin. So, this is the front of the femur, this is intertrochanteric line. So, the origin starts from the intertrochanteric line, then the lower border of your greater trochanter, you come on this lateral lip of gluteal tuberosity, then the lateral lip of the linea aspera. Now, again when you will see the origin of vastus, it will come from the lower part of the intertrochanteric line. Now, here you will have this spiral line. So, you will go with the spiral line, then down you will go on this with the spiral line on the medial lip of the linea aspera with the upper part of the medial supracondylar line. While when you will see the origin of your vastus intermedialis, the vastus intermedialis arises from the anterior surface and from the adjacent lateral side of your femur. It is not going on the medial aspect of the femur bone. Now, what about the insertion? Now, insertion is very important to understand. The quadriceps, all four components converge, and the conversion is going to form a tendon is known as quadriceps tendon, and this tendon ultimately insert on the base of patella. So, I told you that patella is a triangular bone, it is having base upward and apex downward. Now, the this quadriceps tendon continue downward as a patellar tendon or the patellar ligament. So, this is the first question. What is patellar ligament? Patellar ligament is a continuation of quadriceps tendon. Now, here you can see in this diagram that this is your white color quadriceps tendon. Now, this quadriceps tendon is lodging a bone inside, and that bone is known as patella, which is the largest sesamoid bone. Now, from the lower part of the patella, you are having this yellow color extension, and this is going to form your patellar tendon, which is connecting this patella to the tibial tuberosity of your tibia. Now, the rectus femoris. Now, when you will see the rectus femoris, it forms the most superficial part of the central part of the quadriceps tendon, and vastus intermedialis lies just deep to your rectus femoris. So, in this diagram you can see there are two tendons. One is this most superficial fibers of the rectus femoris, and just deep to this, these are the fibers of vastus intermedius. Because we have seen that these are the two midline muscle, one is the rectus femoris and behind that vastus intermedius. Vastus medialis is placed on the medially and lateral is placed on the laterally. So, when you will see the lateral view, you can appreciate that the vastus intermedialis is present here just deep to the tendon of rectus femoris, which is the most superficial part of this quadriceps tendon. Some fibers of the rectus femoris passes from the anterior surface of the patella, and then they will merge with this patellar ligament. So, when you will see the anterior surface of the patellar bone, you will see that there are vertical ridges are present, and these vertical ridges are there because they are formed by the fibers of rectus femoris muscle. Now, the vastus medialis also insert on the medial border of patella up to upper 2/3. Now, what does it mean? That this is your patella bone. Now, this patella bone is having the lateral border, medial border, and this is the base. Now, what we will do is we divide this into the parts. Now, how you will divide? You will divide this base into the medial 1/3, lateral 2/3. Clear? Now, when you will see the insertion of the vastus lateralis, you will realize that vastus lateralis attached on the lateral 2/3 of the base and upper 1/3 of the lateral border. So, this is the attachment of vastus lateralis. But when you will see the attachment of the vastus medialis is having attachment on the medial 1/3 of the base and upper 2/3 of medial border of patella. So, now what you are able to understand that vastus lateralis is having higher insertion on the patella, while vastus medialis is having lower insertion on the patella. Clear? So, in the book you will find this language that vastus lateralis insert on lateral 2/3 of the base and upper 1/3 of the lateral border, while vastus medialis insert on the medial 1/3 of the base and upper 2/3 of medial border. So, because of this pattern you can see that the vastus medialis is having lower insertion and vastus lateralis is having higher insertion. The vastus lateralis attached on the lateral margin up to the 1/3 of your border. There are two more important modifications. They are known as patellar retinaculum. One is present on the medial side, another is the lateral side. These retinaculum are nothing but these are the fibrous expansions, and these expansions comes from the quadriceps tendon and the patellar ligament. And what is the function of these expansions or the retinaculum? They connect the sides of the patella with the contibial condyles. So, here you can see this is the side of the patella and this green color connection is there. Now, this is the medial retinaculum and here is the lateral retinaculum. Now, this lateral retinaculum is supported by iliotibial tract, which is present here on the lateral side. Now, this is very important question for your exam. Now, the question comes in exam is why patella is not displaced laterally, because patella have tendency to displace laterally due to anatomical reason. So, the question comes about the stability of the patella, that write down the factors which prevent the lateral displacement of patella at the time of knee extension. So, why the patella have tendency? Because the pull of quadriceps is oblique. Why oblique? Because you know that the shaft of femur is placed in oblique direction. So, because of this, the patella is, the pull is not in the vertical direction, the pull of quadriceps is upward and laterally. So, because the pull of quadriceps is oblique, the muscle contract and it tends to draw the patella laterally. So, this contraction also keep this patella upward and laterally. But there are three factors which prevent this lateral displacement of the patella on anterior surface of your femur. What these factors? One is the bony factor, second is ligamentous factor, and third is muscular factor. Out of these three, the muscular factor is the most important single factor which prevent this displacement of patella laterally. Now, what is the bony factor? Bony factor says that the lateral condyle is more anteriorly prominent. So, the forward prominence of the lateral condyle. Now, when you will see the inferior view of femur, you can see that this is the lateral prominence of the condyle of as compared to the anterior projection of medial condyle of the femur. So, because this lateral condyle is more prominently comes out on the anterior aspect, it prevents this patella to shift more towards the lateral side. The second thing is that the ligamentous factor. Why? What is the ligamentous factor? That you are having the medial retinaculum here. So, when the patella pushed on the lateral side, there is a stretching occurs in this medial retinaculum, and that stretching of or the tension in the medial retinaculum prevent the displacement of this patella towards the lateral side. So, one is the bony factor, that is the prominence of the lateral condyle. Second is the ligamentous factor, that is the medial retinaculum stretching or tension prevent the lateral displacement of the patella. Third is the muscular factor. Now, this muscular factor says that the lower attachment of vastus medialis. I just told you that when you will have the attachment on the patella, the vastus medialis is having lower attachment, vastus lateralis is having higher attachment. Now, these fibers of the vastus medialis, those are having the lower attachment on the patella, are known as VMO. What is that? VMO. Here it is written vastus medialis obliquus. Now, these vastus medialis obliquus muscle fibers are very important factor because they pull the patella medially and they prevent its lateral displacement. So, the lowest fibers of the vastus medialis insert into the border of the bone, that is patella, and hold this patella medially when the quadriceps muscle contract, and these horizontal fibers are known as vastus medialis obliquus or VMO, which is a main factor to stabilize the patella in position. So, when you will see this is the vastus medialis obliquus fiber, and these vastus medialis obliquus fibers pull this patella medially at the time of quadriceps contraction. Clear? So, whenever you are having this question in exam, that which factor prevent the lateral displacement of the patella, you have to keep this thing in mind. The most important factor is lower attachment or the lower insertion of the fibers of vastus medialis, which are known as vastus medialis obliquus. Clear? Now, what is the innervation of quadriceps? You know that it is again the front of thigh muscle. So, it is innervated by the femoral nerve L2, L3, L4. So, when you are having a test, when you will do the tapping of the hammer with the hammer on this patellar tendon, when you will do the stretching test, when you will do the tapping here on the patellar tendon, you are actually examining the L3, L4 components of spinal cord. What is the action? The action is mainly it causes extension at the knee joint. It is a very powerful extensor of the knee, but The rectus femoris is also helpful to flex the thigh. Why it flexes the thigh? Because it crosses the hip joint from the anterior aspect. Now there is a small muscle in the front of thigh, and that is known as Articularis genu. Now this Articularis genu arises from the femur just below or inferior to the origin of Vastus intermedius. So we have seen that the Vastus intermedius arises from the shaft from anterior and lateral surface, but from the anterior surface in lower part you are having the small origin of this muscle. Now these fibers are deep to this Vastus intermedius, and they will insert not in the bone. Now this is very important question for your exam, that what is the insertion of Articularis genu now, or this Articularis genus muscle. Now you can see that there is a expansion of the synovial membrane of the knee joint. Now this expansion of the synovial membrane of knee joint is known as suprapatellar bursa. So this muscle fiber will go and they will attach to the apex of this suprapatellar bursa, and these are the fibers which are preventing the crushing of this loose bursa between the patella and the femur at the time of complete forceful extension of knee joint. Clear? So it insert into the suprapatellar bursa, which is a bursa of knee joint. Occasionally it blend with the Vastus intermedialis. That's why it is said that Articularis genu is a detached fibers of Vastus intermedius. The suprapatellar bursa is a synovial extension of knee joint. It lies between the femur and the suprapatellar part of the quadriceps femoris tendon, and this muscle pulls the bursa away from the knee during the extension. Clear? So suppose if I will cut this part, that means the insertion of your Articularis genu, what will happen? This suprapatellar bursa will get detached, and when the extension will occur, this part will become loosened and come in between these two bones and get crushed. So this is the muscle which avoiding the downward fall of this suprapatellar bursa and avoid the crushing of this bursa. And why is the bursa is present? This bursa is avoiding the friction between the posterior aspect of the quadriceps tendon and anterior surface of the femur. So to avoid the friction between the tendon and the bone, you are having the bursa. But to avoid the injury of this bursa, you are having additional muscle. This is known as Articularis genu. Now there are two more muscles which you are able to appreciate in the anterior compartment, which are not considered the muscles of anterior compartment, but still you are reading them. One is the psoas major, another is the iliacus, and they are commonly known as Iliopsoas, and these both muscles originate from the posterior abdominal wall. The psoas major arises from the side of the lumbar vertebral bodies and intervertebral disc. Now here you can see these are the intervertebral disc, and this is the origin of the muscle fiber from the intervertebral disc and from the side of your lumbar vertebra in form of arches. The iliacus, you can see that iliacus arises from the upper 2/3 of the iliac fossa of your hip bone, and it is also taking origin from the adjacent part of the sacroiliac joint and the ala of sacrum. They both descend through the lateral half of the gap between the inguinal ligament and pelvic bone. So you can see that this is the inguinal ligament, and there is a gap present between the bone and the ligament. The ligament attached from ASIS to the pubic tubercle, and the gap which is present behind the ligament allow exit to these two tendons, and these both tendon will converge and they will appear in the front of thigh, where you are able to appreciate in the floor of your femoral triangle. Now both the muscles insert as a common tendon on the lesser trochanter of the femur. So this is again the important question, and that's why they are commonly known as Iliopsoas. But sometimes you have the question that when you are having this trochanter, now the question comes is that out of these two, which muscle attached on the tip of the trochanter and which muscle attached on the base of the lesser trochanter. So you have to understand that iliacus insert near the base of the trochanter, while the psoas major insert on the anterior part and tip of your lesser trochanter. So, this is a very commonly asked question in your multiple choice. So, you have to keep this thing in mind that iliacus muscle tendon attached on the posterior aspect of the lesser trochanter, while the psoas major attached on the tip of your lesser trochanter. So, here in this diagram you can see that this is the combined or conjoint iliopsoas tendon, and it is joined by forming two muscles. This is your psoas major, which is coming from the side of your lumbar vertebra, and this is your iliacus muscle. Clear? What is the action? Now, the action is flexor of your thigh at hip joint. Why they are causing flexion? Again, they are crossing the hip joint from anterior aspect. So, iliopsoas is a powerful flexor of the thigh at hip joint. Now, when the foot is on the ground, the iliopsoas act as a medial rotator of the hip joint, but if foot is above the ground, it acts as a lateral rotator. Clear? So, these are also known as postural muscle, and their origin insertion are interchangeable based on the position. But the most common action is the flexor of the thigh at hip joint, and apart from that, it also rotates the your lower limb, and that rotation depends upon the foot is on the ground or off the ground. If the foot is on the ground, then it acts as a medial rotator, but if foot is off the ground or if the foot is in the air, then it acts as a lateral rotator. Now, what is the nerve supply? Now, nerve supply of both the muscles is different. Though they are having a common insertion, but their nerve supply is different, which is a question of your exam. This psoas major muscle is directly supplied by the branches of lumbar plexus. So, the psoas major is supplied or innervated by the branches of anterior rami of L2 and L3 nerve roots. Clear? While this iliacus muscle is supplied by the branches of femoral nerve. So, this is the difference. It is supplied by the femoral nerve. It is not supplied by femoral nerve. It is supplied by the direct branch of the nerve roots. Clear? But the root value of both is similar. The root value is L2 and L3 segments of spinal cord. Okay? Clear? So, at the end of this class, now you are able to understand what are the muscles of the front of thigh, what are the different origin of these muscles. The most important thing and the most frequently asked question is that name the factors which are avoiding or preventing the lateral displacement of the patella. So, this is all for today's class. Thank you.